Medicaid expansion can help address the high maternal mortality rate and the health disparities in Alabama by ensuring continuous coverage before, during, and after pregnancy.
Which side are you on? Which side are you on?
Adam, there's been some updates not updates on Medicaid expansion, but there has been some news recently that has really underscored the importance of Medicaid expansion. What's been going on?
Yeah, absolutely. There's a couple things that, caught my eye recently. One was that there was a new study by a nonprofit tech company, and it ranked Alabama as one of the worst states for poverty support in the country. Surprise, surprise. Smile Hub is the name of it, and it rates charities and provides resources to help donors and maximize the impact of their contributions. And so it looks at, states across the country and what do they have in terms of poverty supports. Alabama ranked 48th overall in the study, which measured 20 metrics across 3 dimensions. And that comes amid some more bad news when it comes to poor and working class folks here in the state. A rural hospital in South Alabama called Grove Hill Memorial Hospital just closed its labor and delivery department last week. As a result, women from the area may have to drive more than an hour to deliver their babies. This is dangerous for both mothers and their babies. Evidence shows that the farther a woman must travel, the more dangerous it is for both, and it could actually cost their lives. So unfortunately, this is just the latest in a series of birthing unit closures in Alabama. At least 4 hospitals have closed their labor and delivery departments since October of 2023, right? Less than a year. And there's even more that are struggling to keep their doors open. More than 1/3 of Alabama counties are maternity care deserts, with some people having to drive up to 100 miles to reach the nearest labor and delivery department. The lack of essential delivery and prenatal care in the Black Belt and other areas worsens the state's maternal and infant health disparities, especially for women with low incomes. However, expanding Medicaid could help keep labor and delivery units open by improving hospitals' overall finances. Medicaid expansion would increase the number of insured patients, reducing the amount of uncompensated care that hospitals provide. This increased financial stability would help keep labor and delivery units operational. There's research showing that a rural hospital located in a Medicaid expansion state decreases the likelihood it will close by an average of 62%, right? So we know for a fact that expanding Medicaid helps keep rural hospitals open. Rural hospitals in states that have expanded Medicaid coverage have more sustainable median operating margins compared with rural hospitals in non-expansion states. And it's worth pointing out that Alabama has the highest maternal mortality rate in the nation. Similarly, Alabama's infant death rates are higher than those in most other states. Alabama has the nation's 3rd highest infant death rate. Black infants and Black mothers experience higher mortality rates than their white and Hispanic counterparts in Alabama. In fact, the infant mortality rate for Black babies is 1.5 times higher than the state average, and nearly twice as high as the infant mortality rate for white babies. Similarly, Black mothers in Alabama are twice as likely to die during childbirth as their white counterparts. Medicaid expansion can help address the high maternal mortality rate and the health disparities in Alabama by ensuring continuous coverage before, during, and after pregnancy. Medicaid expansion would provide more women with access to regular prenatal checkups, leading to early detection and management of potential health issues for both the mother and the baby. Research shows that adoption of Medicaid expansion is associated with lower rates of maternal mortality and reduction in infant mortality as well.
Hey, 5 seconds. Just wanted to say that this is only possible because of our donors. If you want to see more of this, then consider donating yourself at tvlr.fm/donate.
Medicaid expansion has also been found to increase preconception health counseling, folic acid intake, and postpartum contraception. So it doesn't have to be this way. With healthcare deserts and high mortality rates, our state is keeping people from accessing affordable health coverage they can get in 40 other states in this country. Expanding Medicaid is an opportunity to ensure more Alabamians, regardless of where they live, have a fighting chance to stay healthy and raise thriving families. You know, Medicaid is a state and federal health insurance program. It serves more than 80 million people, including adults and families with low incomes, people with complex health needs and disabilities, and people over the age of 65. As you may remember, the Affordable Care Act back in 2010 required all states to expand Medicaid coverage to adults with incomes up to 138% of the federal poverty level, which is about $20,000 last year in 2023 for a single individual. However, 2 years later, the Supreme Court decided that states are not required to do the expansion. It made it optional. And so Alabama is one of 10 states that has refused to expand its Medicaid program. As a result, hundreds of thousands of Alabamians are without life-saving health insurance, and they fall into the healthcare coverage gap. They earn too much money to qualify for Medicaid as it is, incredibly strict under this state, but not enough to be eligible to get financial help to buy private insurance. These are hardworking folks who are left with very few options for affordable health coverage. So to close that gap, there is a diverse coalition that has come together to form Cover Alabama, urging the state to expand Medicaid. Highly recommend listeners go to coveralabama.org. You can find out more there. You can get connected with your lawmakers. If it's been a while since you've reminded them of how important this issue is, I definitely encourage you to do that. Now's a great time to reach out to them. And I also just wanted to point out the economic impact of Medicaid expansion. Just in my county of Limestone County, expanding Medicaid would bring an additional $327 million in additional economic impact, right? Just in one county alone. The numbers across the state are huge. Medicaid expansion could create 20,000 new jobs, right? So even if you're one of those folks who frankly doesn't care about the moral argument, you're not concerned that our neighbors are dying and are suffering needlessly, think about the economic impact and nothing else. It will grow the state's economy. It will keep hospitals in business. It will grow new jobs, right? More folks can participate in the workforce because they'll be healthier. So it'll grow our workforce participation rate. And it's going to decrease the amount of people who have medical debt in collections. About 1 in 5 folks in the state are in collections for medical debt, right? That is something we could help alleviate with Medicaid expansion. So I could go on and on. There's a lot of reasons why our state should do this, and I encourage everybody to get involved with that and to get plugged in. Again, you can go to coveralabama.org. You can find out more there, but I highly encourage folks to get involved in this struggle because there are hundreds of thousands of our neighbors who are suffering, and they don't have to. And we could all benefit. We could all grow this economy from the bottom up by taking care of folks.
You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.